Acute glomerulonephritis, this 1 hour is a challenge. Acute glomerulonephritis is characterized by abrupt onset of hematuria, oliguria, edema, and hypertension. So it is HEHA. HEHA stands for hematuria, edema, or HOHO. Hematuria, edema, hypertension, oliguria. Hypertension, hematuria, oliguria, edema. Clinical severity varies. Mild disease may go undetected. Severe diseases have anuria, hypertensive encephalopathy, heart failure. PSGN is post-streptococcal glomerulonephritis is the most common cause of acute AGN, acute glomerulonephritis in India. We have other causes as well. Etiology of acute nephritic syndrome is going to be three things: post-infectious, systemic vasculitis, and others. Post-infectious, the most common is going to be post-streptococcal. Apart from that, other infections include staphylococci, pneumococci, meningococci, Treponema pallidum, Salmonella, Leptospira, Plasmodium malariae falciparum, Toxoplasma filaria, and then viruses, hepatitis B, hepatitis C, cytomegalovirus, parvovirus, Epstein-Barr virus, Coxsackie, echo, varicella. So in the herpes group itself, varicella, cytomegalovirus, Epstein-Barr virus are all there. And then apart from that, parvovirus, ecovirus, Coxsackie, and then hepatitis B and C. Associated with severe infections, infections of shunts, prosthesis, bacterial endocarditis. Systemic vasculitis, Hinox-Schollen purpura, microscopic polyarthritis, and Wegener's granulomatosis. Others include membranoproliferative glomerulonephritis, IgA nephropathy, hereditary nephropathy, and SLE, systemic lupus erythematosus. Okay, so the key investigations include a renal function test, RFT, urinalysis, serum complement C3, and titers of anti-streptolysin O. So C3, ASO, RFT, urine. Renal biopsy is necessary if the presentation of or the cause suggests or diagnosis other than PSGN. So the indications of renal biopsy in case of acute glomerulonephritis. So what is acute glomerulonephritis? HOHO features will be there. HOHO stands for hematuria, hypertension, edema, oliguria. So with these things, one of the following things have to be present to do a renal biopsy, because renal biopsy is like a big test, right? Systemic features such as fever, rash, joint pain, heart disease, absence of serological evidence of streptococcal infection, normal level of C3 in the acute stage of the illness, mixed features of nephrotic syndrome and glomerulonephritis, high blood levels of urea or presence of anuria requiring dialysis, rapidly progressing GN. Okay, so only if absolutely necessary, only we do such an invasive test like a renal biopsy. Systemic features: one, absence of serological streptococcal infection. Second one. Third one is can't differentiate between nephritic and nephrotic syndrome. Fourth one is high level of urea, and the person passes no urine, and it's a RPGN, rapidly progressive glomerulonephritis. Delayed resolution, also we have to do the biopsy. Apart from that, oliguria, hypertension, with or without azotemia, that is BUN-C is elevated, persisting for more than 7 to 10 days, then we have to do. Gross hematuria 3 to 4 weeks, nephrotic range proteinuria beyond 2 weeks, low C3 levels beyond 12 weeks, persistent proteinuria beyond 6 months. So beyond 7 to 10 days, oliguria, hypertension with or without azotemia. Okay, that is 7 to 10 days. For 2 weeks, it is nephrotic range proteinuria. 3 to 4 weeks, blood in the urine, gross hematuria. 2 weeks on the proteinuria. 3 to 4 weeks, blood in the urine, hematuria. 12 weeks, which is 6 months, sorry, say 3 months. 3 months low level of C3. And then beyond 6 months, persistent proteinuria. Not gross proteinuria and all, persistent proteinuria. Okay, so that's about it. As a quick recap, acute glomerulonephritis has HOHO, hypertension, hematuria, oliguria, edema. The most common cause is going to be PSGN, post-streptococcal glomerulonephritis. Complications include anuria, heart failure, hypertensive encephalopathy. Thank you.